Hello, this is Dr. Seema Bajaj, Senior Consultant, Omya Fertility. In today's scenario, male infertility has become a very common cause, and this causes around 50% of infertility cases. So today we are going to discuss about oligospermia, that is known as low amount of sperm in the semen. For a woman to become pregnant needs a good amount of sperm in the semen. As by WHO 2009, what is oligospermia is when the sperms in the semen are less than 10 to 15 million per ml. It is known as oligospermia. Oligospermia can be classified as mild, moderate and severe. In mild, when the sperm count is 10 to 15 million per ml, and moderate is when the count is less than 10, and severe is when the count is between 0 to 5. Now we are going to discuss about the causes for the oligospermia. The first and the foremost cause is known as varicocele. What happens in varicose? There is a swelling of the veins over the testes which drain the testes. This is the most common reversible cause. Because of the varicocele, the temperature of the testes increases and the quality of the sperm decreases. The second cause is infection. Any infection like HIV, gonorrhea, will cause the inflammation of the testes and the scarring. So this can also reduce the quality and the number of the sperms. Another important cause for oligospermia is hormonal imbalance. These hormones are secreted from hypothalamus and pituitary, and they reach the testes and help with production of sperms. Any imbalance in these hormones can decrease the sperm count. Another one of the important causes is ejaculatory dysfunction. It can be a premature ejaculation or a retrograde ejaculation. In retrograde ejaculation, what happens? The sperm, instead of flowing out, will go back into the bladder. And in a premature ejaculation, the ejaculation occurs before the coitus. Undescended testes. During the fetal development, the testes move from abdomen to a sac that forms a scrotum. If the testes is not at a right position, this can hamper the infertility. One of the other causes anti-sperm antibodies. In this, the antibodies are formed against the sperm, which can kill the sperm and hamper the fertility of the patient. Chromosomal abnormalities. These are inherited genetic disorders which can lead to oligospermia or azoospermia. In this, like Klinefelter syndrome, in which you have 2 X chromosome and 1 Y chromosome, it can lead to oligospermia. Then like Kallmann syndrome and cystic fibrosis also can affect the fertility. Then any trauma or injury to the testes can also affect the fertility. Any medications like any chemotherapy drugs, any radiations can affect the male partner. Now, another is the obstruction to the vas deferens, which carries the sperm, can cause to the oligospermia or decrease the number of the sperms. Nowadays, environmental factors have become a very common cause for low sperm count, like heavy metal exposures, industrial chemicals like pesticides, lead, then painting materials. This can affect the quality of your sperm and the number and the amount of your sperm also. Then any radiations, which if a person is exposed to too much of radiation, this can affect your quality of sperm. X-ray technicians working in the X-ray department have a long exposure of radiations which can affect their sperm quality. The normal temperature of your scrotum is less than your body temperature. Anything which increases the temperature of your testes can affect the production of the sperm. The people working in blast furnaces or underground mines have a high temperature which can affect your sperm production. People sitting on the laptop for stretch of hours or working on the computers may also cause increase in your scrotal temperatures. Patients or men taking lot of sauna bath or hot tub bath can affect your sperm production and affect your fertility also. Now we can discuss some other causes which can affect your sperm production. One of the important causes like drugs like steroid. People taking lot of steroids for the muscle growth can affect their sperm production. Tobacco smoking and alcohol can affect your fertility and decrease your sperm count. Alcohol like 4 drinks in a week also can affect the sperm quality. Emotional stress. Thinking too much about your fertility can also affect your sperm production. Depression can lead to decrease in sperm count, and the weight. Due to weight, you can have more other medical disorders which can affect your sperm production. Celiac disease also can lead to low sperm count. It is a digestive disorder caused by sensitivity to gluten. The count can be increased by adapting a gluten-free diet. Diagnosis of oligospermia can be made by following tests like semen analysis, semen culture, your hormonal tests, then your scrotal ultrasound or transrectal ultrasound, then your antibodies test, genetic test, sperm function test, post ejaculation urine analysis, and then the testicular biopsy. There are many ways to treat the oligospermia. The most important is to have your lifestyle changes. Stop alcohol, stop smoking, and have a healthy diet, exercise regularly, and stay away from steroids. Maintain a healthy weight. Don't stress yourself. Try to do yoga, meditation. And if you have any surgical problem like a vas deferens obstruction or varicocele, these can be operated. If there's hormonal imbalance, the doctor will prescribe you some injections to increase the sperm count. If nothing works, then please consult a fertility expert. There are a lot of options available by which your wife can conceive your healthy and your own baby. Thank you.